Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to today's Wednesday Zoom news conference for the latest in COVID-19 information as it pertains to Amarillo. Let me go ahead and introduce who is on our panel here today. We are joined by Amarillo Mayor Ginger Nelson, Casie Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lamanteer, Chief Medical Officer for BSA, and Dr. Rodney Gonzalez, Director of the Amarillo VA. I'm going to turn it over to our panel for brief statements, and then we'll take questions from our media. At this time, I want to turn it over to Amarillo Mayor Ginger Nelson.
Good morning, Amarillo. Well, we're watching our numbers as always, and Casey's going to talk more about that in a minute, but we've had some drastic change in our numbers this week. She's going to explain that to you. As I watch our numbers, I watch them for warning signs. At our house, we tell our kids all the time that if somebody gives you a warning, it's always given out of compassion. And so I'm watching these numbers and I'm wondering what warnings these numbers are giving us. And they're wanting to give us a warning out of compassion, not trying to control us, not trying to create tension in our lives, but with wisdom, we would watch these numbers and we would watch for the warnings that they're giving us. So I look forward to hearing the report that Casie gives this morning. And I would also just kindly issue a warning about being together this weekend for July 4th. I'm looking forward to it. We all need a moment to celebrate together, celebrate community, celebrate a tradition that we all look forward to, and that is summertime and July 4th, and celebrating what it means to be living in the country that we live in and the blessings that we have in the United States of America. So I look forward to July 4th celebrations, but I also would just like to ask you, please, be careful, be considerate of others, keep 6 feet distanced from each other, keep your gatherings small, less than 10 people if you can, please. Wear a mask if that's something that is safe for you to do. It certainly is polite to do it for other people. And wash your hands a lot, especially if you're eating around others while you're eating. So that's nothing new, but they're great warnings for us in mind today. Dave, that's all I have.
Thank you, Mayor. At this time, let's now go to Casie Stoughton, Public Health Director for City of Amarillo. Casie, how are you?
I think
Casie,
we've all done that. Yes, I think we've all done that at one time or another. So I do have a couple of housekeeping reminders before I talk about numbers. Public Health opened clinical services today at half capacity. All services are available by same-day appointment. Please call 378-6300 to make an STD immunization or TB appointment. 378-6300 is the same number to call for drive-through testing services for COVID-19. The testing site remains operational for those who need to be tested for COVID-19. This week, there will be no report card published on Friday, Saturday, or Sunday due to the July 4th holiday. After tomorrow's report card, the available report card will be on Monday, July the 6th. As of yesterday, there were a total of 3,748 cases of COVID-19 reported in Potter and Randall counties. 2,885 cases in Potter County and 863 cases in Randall County. We have a total of 3,169 recoveries and 46 deaths reported in our community. That leaves us with a total of 533 active cases. Over the past few days, we have seen an increase in cases. Each of the cases represent a unique individual. Most of the days last week, we saw an increase in cases by around 20 cases per day. Yesterday, we saw an increase in 31 cases, and Monday, an increase in 34 cases. Today, we've received many positive lab results. So please, please, please practice those prevention tips. Yesterday, Public Health did report a large number of recoveries. The vast majority of these recoveries include individuals for whom Public Health had no contact information, including cases from TDCJ, mass testing events, and other community testing. For those individuals that we have contact information for, Public Health requires the minimum of 10 days isolation and 72 hours symptom-free to be considered recovered. The individuals for whom we never made contact with, even after multiple attempts. So we call the phone numbers that were given, we mail letters, we make several attempts to reach people. Those people that we are not able to make contact with, including those people who were positive at TDCJ, we provided 4 weeks until considering them recovered, as we were not notified of their deaths. So we did consider them recovered. This 4 weeks allowed for a generous recovery time. It's important that we are able to report and reflect an accurate number of active cases. That way we can see when we can accurately see when the cases start to increase in our community. We want to make sure that we're reporting those accurate numbers. Please remember that at any time we're in groups, COVID-19 is a risk. In the past 4 weeks, since many churches have opened, there have been reports of public health exposure. There have been reports to public health of COVID-19 exposures at churches. Many churches are taking great precautions to protect their members, and we appreciate their efforts. Please remember to wear a mask, stay 6 feet from others, and most important, don't go to church or anywhere else if you're sick or have been recently tested. We remain at level orange here in the Amarillo area. Please use extreme caution when you're in groups. Stay home when you can, practice good hand washing, wear a mask, and stay 6 feet from others. And that's all I have, Dave.
Thank you, Casie. At this time, we now want to go to Dr. Scott Milton, Public Health Authority, Texas State University. Dr. Milton, how are you?
I'm good, Dave. Thank you. This morning, I'd like to just talk a little bit specifically about masks, and so just bear with me a few minutes. You know, I've worn a surgical mask every day to work since this pandemic began in late February, early March. And why do I do that? Because this is a highly contagious respiratory pathogen, this COVID is. Let's think about that. So does PPE work? Does personal protective equipment work? That includes masks. You know, I wear a surgical mask, but when people get diagnosed with COVID, then the hospital workers and the nurses and the respiratory therapists, all the individuals who interact with that patient, has to wear what we call an N95 mask, which is a mask that offers better protection, essentially. And Mike and Brian can probably give us more specific numbers, but you know, over this pandemic, we have treated several hundred patients in our hospitals now with COVID. And in fact, we've had very, very few of our healthcare workers who's become infected and become ill from that. And I think we need to bring out and point out the reason for that is because the PPE works, the masking works. And not only do we have several hundred patients, but think of all the number of interactions that patients and their providers have. It probably is in the tens of thousands of interactions where a healthcare worker may be at risk and in close proximity of that patient. So it's very important to realize that masking is very effective, and you don't have to look that far. You don't have to look in media reports. You can look right here and see what's happening in our communities to our healthcare workers who are providing the care to these patients. You know, one of the most risky procedures that for taking care of a COVID patient is when they can't breathe on their own, and that is called intubation. And many people in the community don't quite understand what intubation is. But if you can imagine, when someone is not able to breathe on their own, then they are breathing usually 40 or 50 times a minute, and if they're infected with a highly contagious virus, then the people who have to put a tube in their throat and have to be within usually about 6 inches of their face in order to do that, usually for several minutes, they are very, very dependent upon the equipment that they're wearing in order to protect themselves. And once again, we have really good numbers, I think, that once again, Brian and Mike can expound upon more about how protective PPE is, and most specifically wearing a mask. You know, our first experience was a basketball game back in early March, and I had the opportunity to actually interview that individual who came in around 2 weeks after being exposed at that basketball game. I've been to many basketball games. My youngest daughter was an all-state basketball player for Amarillo High, and so I know what goes on at basketball games. You're usually standing close together, and you're yelling and screaming for your team. And with that event, I think more than 30 individuals were infected in early March from that. So the takeaway message for me when I learned about that is how contagious this is. So as healthcare workers, the way we view that is that we want the protection of masks and PPE because it works. And so please keep that in mind. I think when we're out in the community through the fourth weekend is to try to keep your distance from people and try to wear a mask because this is a highly contagious virus and it clearly helps. And we have plenty of proof here in our community to lean on for that. So that's all I have to say this morning, Dave. Thanks.
Thank you, Dr. Milton. This time, let's go to Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital. Dr. Weis, how are you?
I'm doing well. Good morning. Hey, happy July 1st. I do want to reiterate what the mayor said, which is July 4th is coming up. We all love to aggregate on July 4th, and please, it's critical to maintain the same vigilance we've done in terms of mask and social distancing and hand washing. And then I want to briefly touch on even a bigger threat July 4th, which is the not uncommon combination of alcohol and explosives. As a trauma center, we see devastating injuries every year to hands and eyes from fireworks. And our incredible hand surgeon, Dr. Glock, he loves to be busy, but he does not look forward to July 4th. When I was at Parkland, we knew that July 4th was the busiest trauma day of the year. And to keep in mind is that first doctor that comes to see you a lot of times has only been on the job for 4 days as a new intern. If that doesn't scare you, nothing will. Okay, so please be careful out there. For those of you that can legally use fireworks, make sure you do not light that fuse if you have that firework in your hand. In terms of the numbers at Northwest, so we have 7 positives right now, 3 in the ICU, but none on ventilators. So this is great. This is about where we've been for the last couple of weeks. So the numbers really look good. We have enough remdesivir to treat 22 more patients. The 3 patients we have now in the ICU, we are treating them all with remdesivir. I want to talk about what Dr. Milton was alluding to, which is we have some interesting numbers. Since the beginning of the viral pandemic, we have quarantined 58 hospital employees because of either high-risk exposure or symptoms. Now, the interesting thing is out of those 58 quarantined, 6 came back positive who had worked on a COVID-dedicated unit. 9 came back positive from community spread. So that actually seems to suggest that you are more at risk in the community than you are working with patients on a COVID unit. Again, supporting what Dr. Milton said, which is the PPE works. If you use it properly, it will protect you from getting this virus. A couple of things, we are having increasing problems getting some testing supplies. As many of you know, now with all the hot spots in Texas, a lot of those are being diverted to the high-risk areas. So we've had a little more unreliability in our ability to get some of the testing kits that we've been using, but we are anticipating more today. One thing I want to know is Northwest Texas will be changing their visitation policy as of Friday. Now, up to this point, we've been allowing 1 visitor in a room at a given time, but that visitor can exchange with other members of the family. And what this has led to is we've had a lot of aggregation in our front lobby as families show up and they trade off visiting. At this point, we decided what we're going to allow is 2 visitors per patient, okay? But no one else can be in the building. So only those 2 visitors, any other family members will have to stay outside the building. And we hope that this will eliminate some of this aggregation we've been seeing in the front lobby. One last thing is, Northwest Texas is part of UHS, and we have some sister facilities down in South Texas. And just to give you an example of what they're going through right now, one of our sister facilities we talked to on Monday, they are a 200-bed hospital. They have 95 patients in that hospital with COVID right now. So they are really getting lit up. And as you may know, the governor has restricted now all elective procedures down in those counties. So our hope is that we don't see this come back. When we were having our surge in April, these hospitals down south were seeing little to no activity. This is their first major surge. But there's always that possibility it could turn right back around and come back up here. So I think we have to be very, very vigilant and careful about travel to some of these areas and making sure we take precautions. So that's all I have for this morning. Thank you.
Thank you, Dr. Weis. At this time, let's now go to Dr. Michael Lamanteer, Chief Medical Officer for BSA. Dr. Lamanteer, how are you?
Good morning. I'm doing well. Thank you very much for asking. And thanks for having me on today for another update with the rest of our citywide leaders and health authority. The past couple of weeks have obviously had us all concerned watching numbers across the state of Texas rise, especially in the big cities in the southern part of the state, as you've heard from Dr. Weis and also from our mayor and Dr. Milton. I think that what we've seen here at BSA over the past really 4 weeks is that we've been hovering in this range of about 10 to 14 patients in-house consistently. And then yesterday we bumped up to 19 confirmed cases in-house. Today we stand at 18 confirmed cases in-house. Of those 18, 10 of those patients are in our ICU, 8 of those are in our med-surg unit. Of those patients that are in the ICU, 4 of them are on the ventilator at this time. So we maintain a fairly steady number of inpatient volume on confirmed positive cases, but we're also seeing an uptick in the number of patients that we're having to test for COVID on a daily basis. The day prior to today, we got our previous 24 hours and we tested 63 individuals for COVID, which means they had symptoms or presentations for that disease. And again, because of those rising numbers that we're seeing across the state and the community, I think it's a matter of time before we're going to start seeing some increased numbers in our hospitals. So we're remaining vigilant in terms of our surge planning. We're remaining steadfast in terms of our staff being prepared and ready and making sure that we have everything here that we can at BSA to serve our community in the Amarillo panhandle, if you will. I'd like to comment that because of the allocation of remdesivir that we received, we've now treated 16 patients with that drug, most of whom have done very well. We've also been continuing to do convalescent plasma therapy. We're at 26 total patients treated with that novel treatment as well. And we're anxious to see how some of the studies are going to pan out regarding those 2 therapies when we can pull data across multiple hospitals across the country. I think that in the setting of the potential for us to have rising numbers across the state and in our region, we want to still remind people that we have telehealth options. We have BSA Docs on Call, which is a way for folks to access their healthcare provider and not have to put themselves at risk if they're immunocompromised of coming into an office setting. They can do that by accessing the website of bsahs.org/virtual care to find their capability of contacting their physician for a telehealth visit. I also would like to say that, we're having a little bit of a celebration amidst the difficult times that we're having across the city with COVID. And that is that we've had approximately 224 recoveries of patients that have been admitted to BSA since the beginning of the pandemic. And our ICU is getting ready to celebrate the 50th recovery that we've had come out of the intensive care unit, which I think is substantial when you think about the care that's required for those individuals that wind up in the ICU, many of whom have been on intensive therapies for days on end, and then have been able to leave the hospital successfully, which we're very happy about. And I think the last thing that I'd like to comment on, again, is we are greatly appreciative of the staff at BSA, our nurses, our physicians, our therapists, everybody on the front line, day in and day out, who's working so hard to keep our patients safe, putting themselves at risk, and really not hesitating, if you will, to continue to help patients, which is fantastic. And then finally, this holiday this weekend is a very important one for our city, for our state, for our country. It's a great holiday, and I think we should celebrate the holiday, but we've got to be cautious. We've got to be careful. I agree with what the mayor has said in terms of just making sure we're trying to keep our celebrations to small groups, that we're wearing our mask in those areas where we're going to be most vulnerable with any type of gathering. And don't hesitate to ask your family and friends, before you gather, are you having any symptoms? Because we still have some individuals that I think, denial plays a little role for all of us. When we're having a little bit of the sniffles or a sore throat, we think, this is just another cold. But any cold today, especially with a febrile presentation, we need to be thinking about, is it possible that I have COVID-19? And certainly not every cold is COVID-19, but there needs to be that consideration. So wear your masks when able, and be safe. Thank you.
Thank you, Dr. Lamanteer. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez,
All right.
how are you?
Good morning. This is Dr. Gonzalez. Thank you again. First of all, let me get into our numbers. Currently, we have 0 inpatients. Now, I will note over the last week, we did have 1 inpatient, but we were able to discharge that patient yesterday. We do have 11 COVID positive patients who are home on self-quarantine. We do not have any PUIs awaiting tests, and we do have 14 since we started monitoring this that have recovered. Now, one of the things, as was mentioned, is we watch our numbers not just locally in the Panhandle, which doesn't appear to be too concerning right now, although there's always that watch. But as we look across the state, on Friday, I had made the decision that we would pause on our continued scheduling of patients. As I had mentioned last week, we were looking at 6 July to increase our capacity to about 25%. I've asked them to pause. Now, we had several patients, over 2,500, that already had appointments, and so we are going to continue with those while we are looking at them to make sure that we can do them. So I know there were a few procedures in there that we had to cancel, but for the most part, we're going to continue with the patients we've made, and we're going to continue to reassess and look more to reopen our appointments around the 20th of July. One of the things, and Dr. Weis mentioned talking to some of his fellow partner hospitals, but as we look at across the VA, as you've probably heard in the news, is several VA hospitals in Texas are seeing quite an increase of patients. And so we're actually sending some of our staff down there to support them. And so we have 7 staff going to be heading down to San Antonio, some of them this week, some of them in a couple weeks, to support their operations for the COVID patients and other hospital operations. And so as we do that, I appreciate the staff willing to volunteer and go down and help those veterans out. Last night, we did have a town hall, which was originally planned to specifically talk about the reopening next week, which obviously we did discuss the decision I made last week. Had about 4,000 veterans participate, and so was very happy to talk to them. I wanted to continue to encourage our veterans in the community, as has been mentioned by the other speakers today, to practice social distancing, wearing their masks, and frequently washing their hands, and limit contact to those in the community, especially if you feel ill or have been around those who are feeling ill. Doing those small steps can really help to mitigate the potential wave of infections from coming to our Amarillo community. I do want to wish everyone a happy 4th of July as we celebrate this nation's independence. I really want to thank our veterans who have chosen to serve and to defend that freedom. And so thank you to the veterans throughout the Amarillo and Texas Panhandle community. And finally, I'd like to once again thank the City of Amarillo and Mayor Nelson for the opportunity to speak here today. Thank you.
Thank you, Dr. Gonzalez. At this time, we're now going to turn it over to our local media. If they have a question for an individual panel member or the panel as a whole, that's perfectly fine. Let's go ahead and start with David Gay of the Amarillo Globe News. David, how are you?
Good. Good morning, everybody. I guess my first question is for Casie, and then whoever on the panel wants to join in, that would be fine as well. With the increase in cases throughout the state in the big cities and in Lubbock as well, do we foresee a spike coming in the next few days, weeks, period of time?
So our cases are starting to increase. Last week we had cases in the 20s, early this week in the 30s. I anticipate at our 2:30 report card that we will see an increase in cases again today. So I think, we have a choice here in our community, and we have a chance to make a difference And so if we can practice those social distancing measures and wear our masks and wash our hands, we can still flatten our curve even more, protecting our hospital capacity, protecting our healthcare workers, protecting those that are most vulnerable are our highest priorities right now, and decreasing our cases. But yes, there is certainly that potential, and we're starting to see our cases rise right now.
David, I want to address that too. Just Casie and I were talking this morning about what the data tells us, and inherent in the data is a built-in delay. So there's a lag time in what the data is telling us and warning us about. And that's so important for us to continue to talk about and for us to keep front of mind as individuals out and about in the community. We look at the report card, we go, oh, the cases were down today. But once we start seeing that slide uptick, it goes along with what the hospital doctors were saying about they're beginning to see more people coming in with symptoms. So we're having to interpret data before the data actually comes to us. And that lag creates a challenge, that delay in how the virus takes a minute before it develops symptoms, before you go and get a test, before that test comes back positive. That lag time is where people are spreading it. They're going to a backyard barbecue. They're going into work because everybody feels the pressure to go to work to support your coworkers and them not have to do your part of the job, and also just to pull your share of the paycheck for your family. I think culturally we feel a strong draw in our city to go to churches, and so we as a city just want to have conversation about where we're seeing contact investigations going toward. They're going toward workplaces. They're going toward backyard gatherings. They're going toward people returning to churches. And so we're not trying to target anyone. We're just trying to give you that information so that you as an individual can keep front of mind. Yes, the more we gather, the more we're going to see those cases go up. And if we knew the exact science of it, we'd say, sure, everybody go ahead and gather this much, because we know this much will keep our hospital staff safe and keep everyone where they have a hospital bed and a ventilator if they need it. We don't have that number. We don't know what that target is, and we can't hit it. So what we've got to do is continue to talk about caution, like you heard all three doctors talk about this morning, caution in the decisions that we make and the number of people that we get around, so that we don't overload things. And it can happen quickly. It can happen in a matter of 5 or 10 days because of this lag time and the way we expose people during that lag time.
Absolutely, absolutely. And I just a clarification on the recoveries from yesterday. You said they were from the mass testing events, Casie. Is that from the Tyson testing, the nursing home testing, TDCJ testing? Can you go into specifics on where those recoveries are coming from?
So it's mainly kind of 3 different places. So TDCJ, mass testing, and then different community testing. So when we get reports, if we don't have, if we're not able to contact the individual, and we certainly make multiple attempts, we call the phone number that we're given, we send letters to the addresses that we're given, we even contact any emergency contact that's given to us. But if we can't contact the individual, or they don't contact us back, then we're unable to do that contact investigation and the contact tracing. And so it's so important that even like when you go to the doctor's office, that they have your most up-to-date information. Many of the cases were from TDCJ, and so we just don't have that information. And so, yeah, all of the above. Absolutely.
That's all the questions I have. Thanks, guys. Have a good holiday.
Thank you, David. This time, let's now go to Paula Alberon of Amarillo, Telemundo. Paula, how are you?
Good, thank you. And you?
Very well, thank you.
Good. Okay, so my question for today is about wearing a mask. In cities like Lubbock, they're requiring business and their employees to wear face masks in those places. Are we going to do something like that here in Amarillo at some point?
I can tell you that the city council has had some preliminary conversation about that in their special meeting that they had on Friday night. And we expect to have that item on the agenda for the July 7th meeting next Tuesday. I don't have an indication as to what the council is really leaning toward. I guess if I had to predict, Paula, I would say I didn't hear them leaning toward that when we discussed it on Friday night. But we will be watching our numbers, and we will have updated data, excuse me. We will have updated data by next Tuesday, and we'll keep watching that trend line. If it's going up, that may be something that council feels is a necessary step. In the meantime, I love the idea that the council would not have to mandate something that just makes good common sense. You have 3 medical experts here today give their opinion on wearing masks. We trust these gentlemen. They're well educated. They're dedicated to our community. They're in the front lines of treating this disease. They've seen exactly what Dr. Milton laid out. They've seen that personal protection equipment does make a difference in controlling the spread. So I would just ask, please wear a mask without it being mandated. And if you're a business owner, I would ask that you do, for the safety of your employees, require that mask, and for the safety of your customers, that you highly recommend or possibly require that they wear a mask to come in and do business in your store.
That's true. And Mayor, another question for you. Can you give us some information about the campaign Wearing a Mask for Amarillo? I think it will be interesting to start seeing more hashtags on social media of people wearing masks and inviting others to do the same.
Yeah, I mean, definitely the theme of today's press conference has been just giving you as citizens information about why it is important to wear a mask. It's not a political statement. It has, I understand just from watching social media and even visiting with friends and citizens about it, that it has a political component to it, which is confusing to me. I think it's not political. It's just polite. And I think it's a good idea. So I'm hoping that people will choose their mask. I know that you can't know everyone's story. So when you see someone without a mask, I have to trust that they have a good reason for not wearing it. Maybe they have asthma and it makes it difficult for them to breathe. Or I'm not sure. Everyone has a different story. But if you're able to wear a mask, I think it's polite and considerate for you to wear a mask.
Thank you very much, Mayor. Muchas gracias. And thank you, David.
Thank you, Paula. At this time, it's now good to, if I'm not mistaken, new reporter at Channel 10, Vinaya Patino. How are you?
Hi, David. I'm good. It's Bonnie. I'm here with News Channel 10. Thank you guys for your time. So my first question is there like a specific demographic or age group that is contributing to this uptick in cases?
So right now the cases are just kind of scattered across the board. We're seeing cases in every age demographic, which is why I think it's so important to talk about those prevention tips. Masking is so important. Social distancing is so important because the virus doesn't necessarily, I mean, we're all susceptible to the virus, regardless of our age, regardless of who we might be, we're all susceptible. And so, and right now we're seeing those cases across the board because we're seeing just people moving about more. And so, so we're seeing those cases everywhere.
Got it. Thank you. My second question is not for anyone specific, but as we see more cases in more populated areas of Texas, are there any plans to maybe transfer some of those patients to local hospitals?
I can say at this point, we have not heard that. I'll be honest with you, we have had that discussion. Certainly when the hurricane hit Houston, there were patients transported from the south of Texas up here for care. And so yeah, we are prepared and ready to help our sister hospitals. I think we have about 5 hospitals down there under UHS right on the border there. So absolutely, if they need us to take care of patients, we're ready to accept them.
Got it. Thank you. And then I guess one of the last questions is, how is the city keeping current on contact tracing as we are seeing this increase in cases?
So we're able to scale up and scale down as needed. And so we have a staff of about 37, and at our highest we had 90. And so we are working on scaling back up as we're seeing those cases increase.
Got it. And we've been getting some calls about local gyms and people not following social guidelines. Are there any kind of conversations that you guys are having with gyms, or any exposures that are coming back from gyms?
I don't know specifically different gyms, but we can certainly look into that and let you know.
Okay, thank you so much. Yeah, that would be great. I think that would be all for me. I appreciate your all's time.
Thank you. This time, let's now go to Aaron Langston of KEMR Channel 4. Aaron, how are you?
I'm good. How are you?
Good.
First question is a negative retest of a patient not required for them to be classed as recovered?
So there's two different strategies. There's a testing strategy and a time strategy. And so most of the time, there is the non-test based strategy or the time strategy being used. So no, a test is not required for a recovery.
Alrighty. And with the recent uptick that we have seen, is there a possibility of us starting to see more restrictions put in place beyond what Governor Abbott put in Friday?
We are limited by what the governor's authority is. So the governor's authority trumps over our local authority. We have very, very narrow ability to put any restrictions over and above what the governor has already set out. So really that all of that control is coming from Austin right now. And sometimes we have more visibility on when it's coming on Friday. We had no idea that change was coming. So we're staying flexible, trying to push out communications to citizens as soon as we hear something from the governor's office. But I think it's important that the choices we make as individuals will govern how much we can stay open here in Amarillo. So if you'll follow the things that we've been talking about, washing hands, keeping your groups to small numbers, gathering in small numbers, wearing a mask, and not going anywhere if you have any symptoms, even if you just think it's allergies or a summer cold, just hold back for a couple of days and watch how that develops, just out of politeness and consideration for those around us. The city council, again, on July 7th, will be discussing masks, and just in general, I don't know that we're moving toward requiring businesses to do masks, but there will just be conversation at the city council level about that. And that is really only, that's the only little narrow lane that local authority still has, that the governor, otherwise the governor is making all of those decisions about restrictions on who can be open and, what kind of COVID type restrictions we might have community-wide.
All righty, thank you. And with the numbers of recoveries increasing, are we seeing more donations of the plasma that has been used to treat them? And if so, how is that treatment going?
I would like to add that, in fact, we are probably in need of more donors for plasma. I didn't mention that in my previous statement, but it's not necessarily just for this community. From my discussions with Coffee Memorial, I think that they have other facilities in other parts of the country, like in Oklahoma, that are having much more of an increased surge right now. And so this is an opportunity that if we could have more donors, I think that would be beneficial, not for only people here in our community, but in other communities that have donated to this community previously.
Okay. Are we seeing good results from the treatment of local patients from the plasma?
I can comment there for BSA. The bulk of patients that we treated with convalescent plasma therapy have done well. And again, I think we're going to need to see the larger numbers and the more widespread trial, which is really, it's a Mayo Clinic trial that is the overriding IRB. That is the Institutional Review Board. And we are one of the local participants in that trial. There are many across the country, and we'll have to see the final study results to make conclusions from this therapy. But yes, some of these patients have done very well.
All righty. Well, thank you very much. That's all I got.
Thank you, Aaron. Let me throw this in real quick on the subject of gyms. If any residents have any concerns at all and COVID-19 policies, they can call our Environmental Health Department at 378-9472. That's not just for gyms, that's restaurants, any businesses that might not be any concerns with them following COVID protocol. That's all the questions we had for our media today. This concludes our news conference. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to thank all of our panelists for taking the time to participate today and providing this valuable information to the community. And we'll see everybody next week. Thank you.
Thank you.
Thank you.
Thank you.